Hey everyone, you would be shocked at how many seniors we've talked to over the last few years that are totally confused on exactly what forms do I fill out and who has to sign what when enrolling into Medicare. Today's video, I'm going to walk you through exactly what forms you need to be aware of if you're going on to Medicare, exactly what to do if you're coming off an employer-based plan going on to Medicare, and ensuring that you fill out these forms correctly is so essential. Stick around, I'll be talking and diving into each of these forms today. Hey everyone, my name is Kelby Hightower with Medicare Hub. One of the things I'd like to tell you right up front is one, we have a guidebook below that you can actually click on. And if you are trying to enroll into Medicare for the first time and you're turning 65 or you're coming off an employer plan, I've got a free guidebook below that walks you through. We've walked hundreds of people through the process of enrolling into original Medicare Part A and Part B, and then setting you up for making sure that you fill out the right forms and everything that we're going to be talking about today. You can click below and grab that guidebook. Now, let's dive into one of the most important forms that most people are unaware of when enrolling into Medicare. And this is going to be based subject line about people that are coming onto Medicare after the age of 65. Often people are working to 67 where they can draw for retirement or whatever your situation is. One of the things that if you've had an employer-based plan and you're enrolling into Medicare, Medicare is going to say, hey, you are supposed to enroll into Medicare Part A and Part B and then have a drug plan at the age of 65. And beyond that, it's going to be penalized unless you can show that there's been credible coverage. Well, the form that you're going to use is called the L564 form. Now I'm going to have that form in the link below as well. You can click on this form. It's pretty simple in that at the top of it, it's going to ask for your personal name 2 times, your social security number, and then it's going to ask for the employer name and the employer address. Then it's going to ask a series of questions. Were you covered? Are you still covered by employer coverage? Yes or no. Is your employer coverage ended? Yes or no. When did the employer coverage begin? You're going to put back to the date of beginning of employment. Or here's a trick. If you don't know, but you've gone in your 68 years of age, go back to the year that you're 65 and put January of that year all the way through the month that your employer coverage is going to sustain itself or end. So if it's March, you're going to put March 2026. And then it's going to ask some other questions about certain types of insurance. And you can say yes or no on that. It's going to ask about 10 questions there of information. You're going to fill that out, and then you're going to take that form and you can actually print it out. You can pull it up on the link below. It's a fillable form and type it in, or you can print it out and handwrite it in if you choose. Then you're going to take that to your employer. Now, a lot of times you have an HR team or a manager, anybody from the employer that's confirming you've had credible coverage, which is what the L564 does. You're going to have them sign that, date that, and then you're going to take the first step in the guidebook, walking you through exactly how to enroll and using your L564 form. Because you're enrolling past the age of 65, you need to show that you've had credible coverage. Now, the next form that's super important I'm going to go over with you is the 40B form, and I'm going to cover exactly when should you apply for the 40B form in conjunction with the L564 form. So a couple of things you should know and you may not be aware of. If you do not have Medicare Part A or Part B, the only way to apply and fill out the 40B form is you have to have a Medicare claim number. Well, when do you get prescribed or given a Medicare claim number? Well, it's when you enroll into Medicare Part A. So one of the things you're going to do first is apply for your Part A. Within a few days, you're going to be able to go into your SSA.gov account. Again, the guidebook's going to walk you through this. But if you apply at SSA.gov for your Medicare, you apply for your Part A. Then after a few days, they're going to provide you a Medicare claim number. That is when you're going to pull up the 40B form, which is going to be in this description below. You can click on the 40B form. And it's going to ask you some general information again, specifically for your Medicare claim number, your personal information. You're going to walk through that form. Very easy. And the other thing is, if you're getting confused on the L564 form or the 40B form, if you call our office and schedule a time, we'll actually walk you through and fill that form out for you. And then we email that to you, and you take that and get it signed, or you take it and upload it and sign up for original Medicare Part A and Part B. So once the Part A is done and you have your 40B form because you have your Medicare claim number, then you can take that and go back in and apply for your Part B. The 40B associates with your Part B coverage. That's the application for Part B. Now, how do you eliminate the Part B penalty and the Part D penalty? Well, that is associated with the L564 form because it shows that you've had credible coverage. Now, one of the most important things that I'm going to cover with you here in just a second, and these are the two main forms I wanted to be able to cover with you today, but I'm going to cover with you something very important about credible coverage when it comes to drugs. Stick around, I'll be back in just a second to cover that with you. Hey, one of the things that happened with the Inflation Reduction Act that was put into action in 2022 that went into full force in 2025 and in 2026 is the true out-of-pocket cost of what Medicare beneficiaries would pay for medication. Now, prior to 2025 of January, you had 4 stages of drug coverage. You would have a deductible for Medicare beneficiaries. So if the plan had a deductible, it would go up to the Medicare allocated deductible amount. Right now that's $625. Back then it was a little less. Then you would have the initial coverage phase. So some plans would have a deductible on tier 3, which would be name brand, or tier 4, tier 5, which are non-preferred or specialty tier drugs. Tier 1 and tier 2 are generic, almost all drug plans. Those typically are very low costing and didn't apply towards the deductible. So if somebody is on generic medications, 4 or 5 medications, they would only be going through the initial coverage phase, which would be a copay amount. And then there's a retail value that would be prescribed toward a percentage amount that goes towards the true out-of-pocket cost. Now in 2025, that out-of-pocket cost max for you was $2,000. This year it's $2,100. So what would happen in the initial coverage if you were taking a lot of name brand medications is that you could hit your max out-of-pocket, and then it would push you into what they call the catastrophic. Now, in 2025, 2026, the catastrophic stage is covered 100% by the pharmaceutical company and the health plan that you're enrolled into. Well, the good news about that is what? You don't have cost. It's 0 cost when you hit the catastrophic. So if you're on a lot of medications, that's great news. The bad news when it comes to credible coverage with employers, because the threshold now has been dropped over half of what it used to be, a lot of drug plan coverages for employers have a higher cost out of pocket. And if their cost out of pocket max is higher than the $2,100 this year, you may be in a drug plan that is not considered credible coverage. So what does that mean for you? Well, one of the most important things you need to do when aging into Medicare is you need to ask your HR or whoever the group benefit specialist is for your company, hey, does my drug coverage, is it considered credible coverage in Medicare's eyes? And if they say yes, then you're good. If they have something in writing, they should be sending you yearly, letting you know that it's credible coverage. Keep that letter, because guess what? Medicare screws up and other people screw up, and you have credible coverage letters showing that your drug plan is valued as a credible coverage plan. Now, when you enroll into Medicare, the L564 form is confirming that you've been on credible coverage for medical and hospitalization, but also your Part D coverage. Now, if you have questions about that, you're confused about that, and you're like, hey, I don't know if my employer will be able to answer that, you need some guidance in that as well, click below, schedule a time. Guys, we'd love to be able to help walk you through how the L564 form is filled out, the 40B form, and we'll provide the guidebook, walk you through the steps, handhold you through the process, make sure that you're informed about the questions you need to ask your employer, the questions you need to ask about your coverage if you're coming into Medicare or coming into Medicare for the first time after an employer-based plan is very confusing. We're here to make your life easy by making Medicare simple. Schedule a time. We'd love to be able to talk.